Hey, Sunshine.
Hey, Sunshine.
Yes. Good morning. Good morning. Hey, y'all. Hey. I've been had so many of them over here helping me. I hope. Can y'all hear me okay?
Yes.
Yes, ma'am. Yes, ma'am.
Okay. Because my microphone is way up. Good morning, Beverly. Beverly got a birthday, y'all, coming up. Woo, woo.
All right. Happy birthday, Beverly.
Happy birthday.
Hey, my beautiful BFF. Hey, Jennifer won the Home Depot card. Girl, you got to post this. Say thank you, Sunshine. That way to motivate folks to come on over here because they missing out on some good prizes now. Hey, beautiful Katina. That's my classmate. And my classmate, my sister. Thank y'all so much for joining. Go ahead and share the video because once you share it, it'll reach your audience. And the more we meet, the better. You know, we told God if we could touch one, but hey, if we could touch many, that's even better. So y'all go ahead and share the live so that we can come in and meet everyone where they are and greet them and educate them, because y'all know Sunshine wants to be an inspiration, motivation, and provide information. So today I hope you get a little bit of all of it, some motivation, some inspiration, and definitely information. So y'all, I love y'all so much. Let me tell you something. Don't y'all put in the chat, Sunshine, what's wrong with you? Because I'm just going to go ahead and tell y'all, eyes tired, boss. I've been running around like a chicken. But I think we all have, but we show up and we do the very best that we can. And we just thank God that we're here, and we thank God for you all. So anyway, let me just tell you who I have on here with me this morning, right? So first of all, before I tell you who I have, in October, we did breast cancer and we also did domestic violence. Well, I found out during that time that two people that I knew had a certain type of cervical cancer. Unfortunately, they're not able to be on with us, but it's just been on my heart to come and bring awareness. So this is awareness only. You know, the ladies are here to provide information, but definitely this is for informational purposes only. See your doctor, okay? Your doctor if you have any issues. This is for information to encourage you to do just that, okay? So I need to put that disclaimer out there. But, you know, it's just been on my heart. And I talked to Melissa, and baby, when I tell you, she said yes. I don't know if I had anybody say yes to me with such enthusiasm before. She said, yes, I will do what I can to help you. Then she left me. She went on vacation. She put me in her suitcase. Okay. But definitely when she came back, she said, let's do this. And that's what we're here to do today. It's just to bring you information. So I have Miss Melissa McDougall. She has an MBA. She's BSN, RN, CVRN. I don't know what CVRN. She's going to have to tell me in a minute. But she is a unit director for cardiology step-down unit at Ochsner in New Orleans. She graduated with an associate's. She has a Bachelor of Science in Nursing and a master's degree in business administration. When I say you education, you got education on here, okay? And but Melissa also has 21 years of nursing and greater than 16 years as a nursing leader. She attends none other than East Jerusalem Baptist Church in Picayune, Mississippi, under the leadership of Brian K. Dees, and she serves as the church nurse. What she enjoys doing: family, traveling, tennis, and reading books. Now, the next beautiful lady that I have on here is Miss Cicely Lewis. She has an MBA, BSc, and same thing. You know, they like two peas in a pod. BSN, RN, CVRN. She also works as a unit director at the for gastrointestinal step down unit at Ochsner in New Orleans. She's licensed practical nurse. She has associate's degree, bachelor in science of nursing degree. I'm going over this fast, y'all. Master's degree in business administration, also from Louisiana State University at Shreveport. She has 21 years of nursing and greater than 13 years as a nursing leader. She attends Beacon Light International Cathedral in New Orleans, Louisiana, under the leadership of Bishop Daryl S. Brister, and serves as a church nurse. She enjoys traveling, exercising. Lord help me, I need you to be my oh Lord, exercising and spending time with her family. So that, I mean, those are almost identical. So this is why they are together. They're definitely a powerful tag team nursing duo. So welcome them, y'all. Say welcome, Melissa. Welcome, Cicely, in the chat. And I'm going to turn it over to Melissa because she has information to share with us on cervical cancer this morning.
Good morning, everyone. Can you guys hear me well?
Good morning, Sunshine. Yes, we can hear you, beautiful.
Mine is kind of echoing. I'm not sure why.
Oh, no, we don't hear any of that.
Okay, well, I'll keep talking through the little static. I hear like some static and echoing. So like Selena said, I'm very excited this morning to bring you guys information, to bring everyone information and to increase awareness for cervical cancer. My partner in crime, Cicely, thank you so much for being a part of this with me. The main thing is to know what cervical cancer is, and it happens in the cervix, and that's the lower part of our vagina. The biggest cause of cervical cancer is something called HPV. I know many people has probably seen commercials about HPV vaccine, and it's important to get your child vaccinated when they reach 11 or 12 years old. But HPV stands for human papilloma virus. That plays a significant role in cervical cancer. So we wanted to bring awareness to this and let you guys know some early signs and symptoms, and to answer any questions that everyone may have regarding cervical cancer. So Cicely can talk about the early stages of like signs and symptoms that you will see if you think that you have cervical cancer.
I thank you guys so much for inviting me. It's such a pleasure, and happy Saturday to everyone.
Yes.
But yes, definitely, I do agree. When you say happy, hey, Sunshine, I do agree that for your disclaimer, please, connect with your physician is most important. Just remember that this is definitely us just giving and providing information, bringing awareness. But early signs and symptoms, you can experience vaginal bleeding after intercourse, between menstrual periods or after menopause, watery or bloody vaginal discharge you may identify, or you can even have a foul odor and possibly pelvic pain during or after intercourse.
So you ask yourself, what causes me to get breast cancer? I mean, cervical cancer. Kind of like breast cancer. We don't know the cause of many cancers. They just happen. But cervical cancer starts when healthy cells in our cervix, they start to change and mutate. We know just from dealing with COVID, the virus has changed now 5 times because viruses mutate. That's what they do.
Yes.
So cervical cancer, the cells also mutate in their DNA, and it tells the healthy cells, it attacks the healthy cells, and then they start multiplying. And when these cells invade our tissues, they break down into a tumor. And then if we don't catch this early, y'all, the tumor will start to spread. The cells start to spread, and that's called metastasis. So there is no clear understanding or definition of why people get cervical cancer, but I do know that there are two main types, and one is squamous cell cancer. This cancer starts in the thin, flat, it's called squamous part. It's the inner lining, it's the lining of the outer part of our cervix. And our cervix kind of projects into our vagina. The other one is called adenocarcinoma. This type of cancer is it's a column-shaped glandular cell that lines our cervical canal. So those are the two most common types of cancer. So Cicely will talk to us about the risk factors and how do you know if you are at risk for cancer. We all could be at risk, but these are some main things that our research showed us.
So some of the risk factors, you guys, are multiple sexual partners. The greater number of sexual partners can have a great risk for HPV. Early sexual activity, having sex at an early age can increase your risk. STD, as they say, sexual transmitted infection, STI, having such as chlamydia, gonorrhea, syphilis, HIV/AIDS, increasing your risk of cervical cancer. You can have a weakening immune system, smoking, and then also exposure to miscarriages prevention drugs. It's all possibilities or risk factors for cervical cancer.
So
Melissa,
you may.
these are some of our preventions.
So you may say, well, what can I do to decrease my chances of getting cervical cancer? The first thing and most important, like Cicely mentioned early in the broadcast, is seeing your doctor. You go see your GYN. Your gynecologist will perform a pap smear. And during this pap smear, he or she will scrape our uterus, and they take those cells and they brush them onto a smear, send them off to the pathology lab, and the lab will check for any abnormalities. Go see your doctor. But some routine things is you can ask your doctor, hey, can I get the HPV vaccine? Do I qualify? Most important, the pap smear, making sure you're having safe sex to prevent sexually transmitted infections, using a condom every time you have sex, making sure you don't have a lot of sexual partners. And another important factor is don't smoke. Pap smears should be every 3 years. I go every year because I'm over 50. So when you're between 20 to 29 years old, you should get a pap smear every 3 years. Once you hit 30 to 65, that's when your pap smear should be every year. And what's been happening that we've been seeing on the medical front is people are not going to the doctor because of COVID. And we are trying to bring awareness so that, hey, go see your doctor. If you're going to Walmart, you're wearing a mask, guess what? Go to your doctor, wear a mask. They're using safe precautions in your doctor's office, just like you would do when you go to the drugstore or if you go to the grocery store. So we want people to just basically still wear your mask.
And I definitely support what Melissa saying, you guys. Please don't allow COVID to stop you from moving forward in having your daily routine checks. And I mean, I know we're talking about cervical cancer, but we have to take care of our whole body holistically, right? That falls in with your pap smears, going to your dentist every 6 months, and getting your blood work taken care of. Take care of everything and make sure you do that every year. We cannot afford not to have our yearly exam in the event something is there. Early detection is the key.
Detection.
Yes, early detection.
I got to say that one early because we
Yes.
talked about that before we went live. Early detection is key, and we want to do something every single month to bring you awareness, because even though we're not, we probably, I'm sure they will tell us some stuff we don't know because we're not in this field. But most of these things you already know, but we're trying to bring it to the forefront of your mind so that you will still take care of yourself. 2 years ago, 2020, we were all running scared and afraid. But now it's time to kind of get on back out there. You go to the grocery store, go to the doctor. You go to the doctor. Just be
Yes.
careful. Do what you've been doing.
Yeah.
Wear your mask. Use your hand
Yes.
sanitizer.
Yes.
Wash your hands. All
Yes.
the things that we do, you
Yes.
just continue to do it a little bit more and move forward with your life. We have
Right.
got to continue to live. We cannot live in fear. Okay, so I'm gonna go back to being quiet and
And,
listening. I'm
and,
sorry.
and, and I definitely agree. You can't live in fear and faith at the same time. So you
Mm-hmm.
have to choose. But I'll agree, just continue to have your social distancing. And as you see in the clinics and in the doctor's office, they have hand sanitizer everywhere you go.
Everywhere.
Everywhere you go. But again, early detection is the key, not just in cervical cancer, in any type of cancer across the board. Just to share a little background, something personal. My father, he died at 44 years old with colon cancer. Colon cancer. And right now I am 47. So that means that I have to see my physician versus going every 10 years for a colonoscopy. I have to go every 5 years. Me, myself, and all my siblings, just because, that's our father and, first line.
Mm-hmm.
So it's the same thing with the cervical cancer. And he did go in early on and received the treatments and did the surgeries. We all know everybody have their time, right? When you're born and when you will die. But early detection is the key. I cannot, or we cannot stress that enough. And I know sometimes we may have the mindset that I don't have no symptoms. I don't have no signs. I feel good. Even though those things are happening, we're glad you're feeling good. You want to continue to feel good and be healthy. It's about what's happening on the inside. It's not what's on the outside.
Because that stuff
Absolutely.
could kind of silently be doing its thing. And then once you do start having those symptoms, it's like, I'm sorry, it's already stage 4. You
Yes,
Right.
know, so definitely whenever you have that first line in the family, then you automatically know. That's why they ask you for your family
history.
history so
Absolutely.
that they can encourage you. Okay, since you have a family history of high blood pressure,
Yes,
cancer, whatever it may be, then
yes,
this is what we need for you to do. But we
yes,
can't put like we can't put our life in our doctor's hands. There was a time where
definitely.
I was so sick that I just kept going to the doctor, leaning on them to, try to help me, being turned away, take this medicine, take that medicine. Nothing happened. So I almost was not going to be sunshine sitting here today. But because of Ochsner, that's where I was. I did go to Ochsner in New Orleans, and then I ended up at the one in Slidell. And there was this doctor. Man, I feel like if Mama could marry him, she would, because she just loved this doctor to death, and so did I. He was like our real live house. That's what he was, because he was determined to try to figure out what he could do to help me. And so I thank God for him. But I done got all sidetracked what I was saying, but
No, that's great.
That's definitely okay. Sometimes
yeah,
we'll reel you back in, but
yeah, just
I
bring
like
me right on back in. But
yes,
I just wanted to, just chime in with wherever I could. But Lord
yes,
bless the Lord. I just
yes,
get too excited, and I definitely get emotional when I get to talking about it, because I'm so excited about still being here. Oh, I was saying just about being your own advocate. So
yes,
I was leaning to the
yes,
doctors, but you have to do your research. They may not like it when you don't went to Dr. Google before you went in, but at least you try to educate yourself. It's not
yes.
like just random information. Google can give you some really good information about the symptoms or whatever you got going on, and you can go and talk to your doctor and say, listen, this is what I got. This is how I felt. I did do some research. So they'll know you didn't just come in there and you don't know anything about what you got going on, because that's the first thing they're
Mhm,
going to ask you.
mhm.
Tell me a little bit about what's going on with you. And so that's just my side that I want to encourage. I was dependent totally upon a couple particular doctors, and finally this girl said, let me tell you, he don't like a challenge. I was like, what? Because I was definitely a challenge. Nobody knew. But I need for you to know. I need for you to go see about yourself so that you can live your best life. We
Yes,
want the
Absolutely.
whole body,
yeah,
mind, and
yes,
everything
yes,
to be
yes,
good.
yeah. Because we only have one temple, right? And we need to take care of that. That's all, just one. Um, that's definitely true. I'll agree. I piggyback on what you're saying as far as being your own advocate. When we have patients come into the hospital and they admitted, it's when we train other nurses, we tell them, listen to your patient. The patient who know you better than you. So it's very important to listen to what your patient have to say, but reporting your signs and symptoms as early on as possible and reporting everything when you go see your physician is definitely key. Because
Mm-hmm.
if you're not transparent, if you don't share everything that you know, and what's going on with you at that time and in real time, then it's very difficult for the doctor to be able to make a sound decision and to give you the diagnostic test, whether it's blood work or a CT scan or whatever type of screening that applies to your situation. So when you have symptoms, please say something, do something about it. You got to put things into action, not just, take something over the counter and think that it's going to subside. And I know and guess what? We all prone to doing that, right? You feel certain ailments and you try to treat it, or you do some holistic things. I get it. But guess what? When you know better, you do better, right? And you want to apply those things.
Absolutely, Cicely. The last thing I wanted to bring up about cervical cancer is if you've had a hysterectomy, that doesn't mean you don't need to still see your gynecologist and to have a pap smear done. Your gynecologist knows what's best for you. So consult with them, because you still need to have a pap smear done uh, at least probably every 3 or 5 years. But your gynecologist will let you know what's best for you. So just because if you had a hysterectomy doesn't mean that you're exempt. Still go see the doctor.
That is some very helpful information, and that's very good that you brought that into the forefront, Melissa, because I had a cousin that thought the same thing just because she had a hysterectomy, that she was exempt from the examinations and a possibility of her not uh, getting cervical cancer, but it's a strong possibility. You still have cells and things that can develop, without you knowing.
Wow. I'm telling you, your body definitely has a way of trying to fight to live, within itself. It's fighting off so many things. Like we said, by the time you start to feel the symptoms, because your body been having an internal thing trying to take care of, the cells or whatever that is causing the cancer growth. If you don't have the early detection at the end of it, like I said, by the time you go, this one young lady, she told me she was stage 4, because we don't go see about ourselves regularly, and we're not our own advocate. And your body is magnificent, so it's been trying in silence to fight. And after a while, it's like, hey, you not seeing about me. It's like the
Right.
car, that engine. It's like, listen, you
Yes.
ain't had no tune up, you ain't put me no oil up in here, you ain't give me nothing to work with, so it's done put it out. Timing belt broke, all of that. Engine, all of it
Yes,
gone.
yes, it's the same concept. So you're exactly right. The engine to your car, you take care of the car gonna take care of you, right? So it's
Mm-hmm.
the same thing with your body. So I definitely agree with that. Man, this was so helpful. In my research, I even learned more information myself. So this is very, very helpful.
That is so awesome. I love it. It's a good thing to continue to learn. I was trying to somebody told me something the other day, and maybe y'all know it. You know how we always say knowledge is power?
Yes.
But this guy put a spin on it for me. I'm gonna have to ask him and put it and post it afterwards, because Okay, so basically he was saying, okay, the knowledge is power, right?
Right.
But if you don't do anything with it,
Right.
what good is it going to do you? You
It's
can have all
useless.
this information, all
Yes.
this knowledge, but you
Yes.
have to do something. And I can't remember what he put at the very end, but you basically get the gist of it. Faith
Yes.
without works is dead.
It's
So
dead.
you have
Yes.
to do. You cannot just sit on this live, hear us
Mm-mm.
talk about early detection, hear us talk about being your own advocate, and don't schedule an appointment. So when Monday roll around,
Yes.
everyone should be calling their physician, scheduling an appointment, whether it's a mammogram, whether it's a pap,
Yes,
whether
ma'am.
it's just your normal annual follow-up, whatever
Yes.
it is, you should be on the phone. And if we have, I don't even know how many people, because sometimes the number is not accurate, but we're gonna have people watch the replay. So if you're #replay person, you need to tell at least 5 people. If we telling you, you
That's
tell
right.
5 people in your family, your friends, your coworkers, a total of 5. We're going to give you that responsibility of 5 people to say, hey, have you scheduled your doctor's appointment? Have you scheduled your checkup? Please do so, because I watched this live this weekend and they were talking about ABC. However you come across, we want you to reach out to 5 people. And matter of fact, make yours first. I'm gonna be number 1. I'm gonna post it that I made my appointment.
Okay.
Be number 1. I'm gonna do 5 people. We're gonna do 5 people. They encourage people every day, but we just gonna commit.
Yes.
We're gonna commit to 5 more people
I like
on
it.
Monday to schedule appointments, y'all. This is so serious. You know, we've gotten so focused on just COVID, 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 COVID. We done forgot everything else. Like, don't
Yes.
nothing else exist right now except
Right.
for COVID.
Right.
Your body is over here struggling.
Yes.
And you talking about, oh, I sure hope I don't get COVID. Well, what about everything else?
Right. Right. Yep.
So let's come on back. Let's get our vision back in focus on our vehicle. We got one vehicle to make it through this life, and we have to take care of it. I will admit to being the abuser of the body. I have abused this body, but starting on tomorrow, we're doing a 21-day transformation challenge. I sent the information to Melissa right before we got started, to start eating better, to start exercising. I saw that Cicely loves to exercise. I'm gonna have to call her and be like, girl, how do you motivate yourself just to love to exercise? Because people frowned on it for so many years. Oh Lord, I gotta exercise.
Yeah, it's all about the results. The results.
It's the result. And then you have to surround yourself around like-minded people.
Yes.
If you around people that's like, oh God, I gotta exercise, then that's how you're gonna feel. But if you're around people say, oh my goodness, I'm about to go to the gym, because
Right.
Melissa and I already told her that's what she about to go. As soon as we hit in, she's on her way to go work out. You know, if you're around people who that's important to, it's gonna become important to you too.
Yes.
If you have an open mind. Some people are so closed-minded. They're like, she get on my nerves. All she do is talk about exercise. But if you looking at her and you seeing how she's able to do all these things in a day because she's taking care of her body. Exercise don't make you tired, really. Exercise, when you do it continuously, gives you more energy to do even more things.
Right.
Cicely do get on my nerves, Selena, but she has a famous saying. What is your famous saying, Cicely?
I don't know.
You gotta make your body do what?
What your mind don't want to do.
That's the truth. That's the truth. Listen, I'm gonna make you have to get up off of Cicely. Come on, Cicely, get on your nerves.
Sunshine. She really motivates me though, because I'm laying in the bed and I don't want to do it. And she said, Mimi, you have to make your body do what your mind is telling you it don't want to do. And I'm like, okay, I'm getting my butt up out of bed.
Because most of the time, once you get dressed and you get in the groove, and once you get on that treadmill or that bike, or you going walking, and guess what? You don't have to work out for an hour, you guys. I mean, you could do 30 minutes. It's just you need to have some type of movement going on and get that heart rate up, and you really will feel so much better about yourself. Your body will feel good, and not just that, it helps you mentally as well. You can use that time as a meditation time, just to kind of regroup and to refocus.
And I had a lady tell me exactly that. It's like you're doing multiple things at one time. That's her prayer. That's her prayer time when she's out walking or exercising. So she's not just walking exercise, she's also spending time. It's like you don't have to be on your knees for your prayer time. And she had to retrain her mind that, hey, I can actually exercise and pray and meditate, at the same time. So it's not
That's
like
right.
you're taking away any time. You're actually
Mhm.
maximizing your time.
Mhm. Mhm.
Mm-hmm.
Absolutely.
Yes, I love it. So I was gonna put up, hold on one second, let's see, where is it? Oh, I typed it, but I guess I didn't save it. Let's see. Any questions for the people that we have on here now? If you're watching the replay, I'll look out for any questions that you may have later, and I'll send it to the ladies. So don't
Oh
feel
yeah.
like, oh, I'm not on the live, so I missed out. If you have any questions, put it in the chat anyway, and we'll send you the answer the best way we can. Good morning, Vinny. So I want to go back up here to Tricia. What did she say? She said it's what you do with the knowledge that makes it powerful.
Yes, I'll agree.
Yes, so I do too. I agree with that. So we just definitely want to, and if you didn't used to be that person to do, let's be the doers now.
That's
Let's
right.
be the doers.
That's right.
It's never too late. Never too late to learn, never too late to do.
Yep.
Oh,
Never.
there's Tanya. Hey, good morning. Good morning, sunshine. There's my cousin. I call her my auntie. So Jennifer says, I do mine faithfully as scheduled. It is important to me because that's my life.
Yep.
I love it, Jennifer. That's exactly right. She says she do hers faithfully. She said, don't play with me.
Yes. Awesome, Jennifer. Keep up the good work.
Yes. So if y'all have any questions, you can go ahead and put them in the chat now. I did have one question. Now, it was about, as soon as you said HPV vaccination, boys also can get that vaccination, right? So it's not just for females.
Right. It's all children, girls and boys, starting at age 11, should get the HPV vaccine.
Mhm.
And my research showed that even if you're like 17, if you have a 17-year-old up to 26 years old, they should get the HPV vaccine because it's a sexually transmitted virus. It's not like HIV, but it's human papillomavirus, and that is the main virus that causes cervical cancer. So girls and boys are supposed to get the HPV vaccine.
And that's up to what you said, 26?
Yes, 26.
Yeah.
Okay. All right. Girl, I cannot wait to go get my appointment. I ain't never been so excited about annual in my life. I was like, oh, but today, just because I know that it is going to help somebody else, I'm excited about going and just spreading the word. Anytime we can help somebody else.
Right. Early detection is the key. Early detection is the key. With cervical cancer, just like many other cancers, by the time you start to feel some of those signs and symptoms that Cicely talked about, it's too late. You've already had stage 3 and stage 4. And then a lot of times, guys, it's already spread to other parts of your body. So early detection is the key.
Early detection is the key. We have said it over and over.
Yes,
so
yes,
hopefully
yes.
by at the end of this, you will understand what. Can I hear y'all say it?
Early detection is the key.
Let's see here.
Go see your doctor.
Good morning, Octavia. Y'all coming on in the room now. That tickles me when they say come on in the room. Let me think about a hymn. Come on. Come on. That'll be one to sing when I hear people say that. After what I've gone through, I faithfully go to my appointments. That's very good, Tricia.
Yes, I love it.
Yes, we do. Y'all coming in saying that you're faithful about it. That is awesome.
And
So
to keep yourself on track, you know, if your doctor say, I want to see you again, Melissa, in 6 months, make
yep.
that appointment before you walk out of the
Before you
office.
leave. Before you leave. Exactly.
Even your dentist appointment, you go to the dentist every 6 months.
That's right.
Put the appointment on the books, because you can always change it if you see that you have something conflicting, but make that appointment before you even walk out of the office.
Yes, that
And then
always helps.
add it to your phone. Add it as a reminder so you don't forget. We all have cell phones. Don't even say, I had it. If you don't know how to do it, go get your 2-year-old, 3-year-old niece, nephew, grandchild. They could put it in there.
Yes, that is so true.
No,
And
I'm
this day and time,
exaggerating.
your doctor's office will send you a text
A
reminder
reminder.
2 or 3 days
That's
before
right.
your doctor's appointment to say, hey, don't forget us. You coming to see us? So yeah, it's vitally important.
It really is. And we have no excuses. That is what has hindered us probably most of our life. We come up with all these reasons, excuses why we can't, but it's time to just like, no excuses.
Yep.
I mean, if the doctor sends you a reminder, you got reminders on your phone, you can make it before you leave. You can even do your telehealth appointment initially and say, listen, this is what I was feeling. I needed to come over here, and what day can I come in? Is there something you can tell me? Because that's how they're doing it. You can do a lot of appointments virtually.
Yes, you can.
Also need to go in. So there's no excuses
There's
at
no
all.
excuses at all. Yep. So everybody assignment is what we're going to phone a friend, right? We're going to touch 5 people, including yourself.
Jennifer says, that's what I do when they give me the dates in 6 months or a year. I put it in my phone right then. Girl, yep. Jennifer, you get the
you're
date
awesome.
today. Yes.
Jennifer is awesome.
She is the star student on today.
Yes.
All right. So y'all have had just a few minutes for questions. I don't see any in the chat. Please put thank you to Melissa and Cicely for their time on this Saturday morning. Oh, wait, let's see. We got a comment. My grandmother passed away with cervical cancer. I have a hysterectomy.
Wow.
Oh, I thought and was told I didn't need an exam. But a few months ago, I asked them to give.
That's right.
Wow, that's what they told you?
Wow. Yeah. And guess what? Nothing is wrong with a second opinion, you guys. Get a second opinion.
Get a second opinion. That's right.
Wow. That goes back to advocating for yourself.
Well, I'm so thankful that you asked for one.
Yeah, me too.
Golly. And again, we think that they know it. It's their job to know. But you can go to 2 different people and get 2 different responses. So
right, absolutely.
You're so very welcome, Tanya. So, ladies, I don't have any questions. So, but we did have some interactive people. I didn't interrupt y'all to say all the good mornings. I tried to say the good mornings at first, but I did put the comments up on the screen. So we're just thankful for everyone. Thank you so much, Octavia. She said very informative. Thank y'all. Oh, you're so very welcome. That's
so
what we're
welcome.
here for.
Yes.
But thank y'all for y'all Saturday morning, the tag team duo. y'all tickle me this morning. So Jennifer says thank you as well. Jennifer, you're the star student for today.
Yes, Jennifer.
So what did I want to say? Tonight we're going to be back at Poplarville for Chapel Hearts concert. I don't know what I keep saying Chapel Hill, but Chapel Hearts concert. Sunshine has a press pass, y'all. That just tickles me to hear me say, I got my press passes over there in my bag. I don't want to get there and forget it, so I already got it in my backpack. I'm not going to be live during the entire thing, but I will go live initially right when the concert gets ready to start. I plan to hit the go live button, but after that, I'll just be there being supportive, being my ray of sunshine that I am, showing up, being on somebody's camera. I'm going to be on somebody's camera.
I love it.
I know, right? But I think that was it. One more thing.
Wear your mask, guys.
Yes.
Yeah, wear your mask. So y'all might not be able to recognize. I don't know. This gonna tell y'all who I am. This big thing right here is all over my head. But hey, I do have tickets to the Ron DZ comedy show. I will post that here in just a few minutes. All I need you to do is simple. I'm trying to grow my YouTube channel. So if you subscribe to the YouTube channel, so you like the post, subscribe to the YouTube channel. If you already subscribed, what was the instructions? Share. So share the video. And then you'll get a chance to win. I have 2 tickets to the Ron Deasy comedy show that's going to be Saturday. This coming up Saturday. So we want to support him. He puts a lot of work and a lot of effort into it. So there we go. I gotta post it. I will post it today. So because it's only a week away, and I need y'all to know in case you got to go get your outfit. You got time to go get your outfit if that's what you need to do. But we all know you got something up in that closet, but COVID might have you where you can't fit anything. So you have to go get your outfit. But if you jump on with Melissa and Cicely, you'll be fine. There's no time. Or Sunshine, because we got that challenge coming up tomorrow. So I'm also Coach Sunshine. So come on, because take a picture. You see these chubby sheets? I'm finna have a 21-day transformation. It's gonna be slim and trim. You're gonna be like, oh, Sunshine, you got rid of that double chin. All right. I love y'all so much. Thank you for joining in. Please share the video. If it's hashtag replay, put hashtag replay, put your questions in. I will get it over to the ladies so that they can answer your questions. All right. Y'all have a super Saturday.
Awesome.
Thank
I'll
you.
see you all later tonight. Thank you, ladies, so much.
Thank you so much for inviting me.
Thank you.
Yes, thank you. Keep it smiling, Sunshine.